This comes as a study finds about 7 in 10 adults say that denials for health care coverage by insurance companies or profits made by health insurance companies also bear at least a moderate amount of responsibility for Thompson's death. With renewed attention on health insurance, the public taking to social media to share their experiences with the industry, including our next guest, who says she used to work for UnitedHealthcare. Her TikTok now going viral.
Well, I worked for UnitedHealthcare for maybe 9 months. Here's my story. I worked in the medical claims department and went through training for about 2 to 3 months to get out on the claims rep floor, and was taught so many different ways to deny.
That is Natalie Collins. She is now the owner of Mother's Keeper Doula. She joins us now to share more about her experience. Natalie, I appreciate you making the time, and I want to start with what you just said there. You say you were taught so many different ways to deny. Tell me more about that. What did you feel you were encouraged to do?
Every policy is completely different. So there was medical jargon in each policy that led us to have to follow these procedures. But more or less, we weren't given proper instruction to actually pay the claim, and there wasn't enough monies in certain files in certain companies to pay medical claims. So we would have to just get the client off the phone as fast as we could. And then if they weren't liking what we were saying from the script, then we would just call a supervisor and they would stand behind us. And while I was crying, they were laughing.
You would actually cry on the job sometimes?
Oh my gosh. It was so sad. It was so heartbreaking. I was the bad guy every single day. Does that not feel good to anyone? Like, that doesn't feel good to me.
Was there pressure to find ways to deny claims? What exactly were you told?
We would have to go through multiple series of completions to see if we could push through claims, and sometimes it would get kicked back to us and be denied straight to the rep, and sometimes we would get them back. They would come back and we would think that they got paid, but they actually didn't, which is my fear with this claim that I was originally talking about. So
yeah, tell us more about this, because you say there was one specific hospice claim in particular, a widowed woman who called you. You say her husband had passed from pancreatic cancer, left her with 5 boys. And you say they, quote, told me every which way to deny this woman to get her off of our phone line. Tell me more about this case. You call it despicable.
They just wouldn't allow me to submit the claim. There would be alerts on each claim telling us that either we had to put it back in our queue and it would just go to someone else 30 days later, 60 days later, however they had it set up. And then we would have to manually go in and try to find that claim. And that's what I ended up doing, was to go in there and find it and pay it myself. But yes, if there was things being said or lots of phone calls being placed by the same caller, then supervisors would be behind us, instructing us to tell them certain ways to deny it or just to get them off the phone.
How did you perceive your role while you were there? Did you feel that you were truly there to help connect people with these services, to help them achieve their healthcare goals?
Not at all. Simple answer, not at all. It was just a sad building all around.
Mm-hmm. And you say that you eventually did try to apply money to this specific woman's claim, the specific woman's case, and then you say you shortly quit after that. Tell me what happened.
Yeah. So once you get out on the claims rep floor and you're approved a certain amount of monies to pay dollar amount claims, I hit that amount for this woman's claim, and that was the only one that I went in that day to pay. And the moment I hit paid, we went on. It's like a timeout thing, and I just went over to my supervisor and I gave her my badge and I left.
That was the straw that broke the proverbial camel's back in that moment.
Absolutely.
There is so much interest in UnitedHealthcare right now, with this system in general, with Luigi Mangioni's case. I mean, we're looking at more than $200,000 the public is funneling into his defense fund. What is the message that you want the public to know, having seen the system from the inside?
Oh, that's a loaded question. That's a loaded question. I would push your employer to get you guys a better plan. It's all about your employer and who they are negotiating with to get their employees the best health coverage. So your plan at these certain companies can be great, but the other employees that work in different departments can have different things offered to them, and people have quit jobs to find better coverages elsewhere for just health insurance.
Oh, absolutely. Tell me why you're choosing to talk about this on social media now.
I've had this story just like circulating in my head for about 11, 12 years now. And I mean, it's a hot topic right now. So, and someone just made a comment on one of my TikToks saying like, yeah, talk about UnitedHealthcare. So I just did it, and I woke up the next morning and was shocked. I thought I was just going to reach my doula community. We were going to have a conversation about like other doula coverages, but I'll start talking then. So
Yeah.
it got big.
What is your message to insurance companies in this country?
We, the people, are sick and tired. We're fighting so tooth and nail every single day. My neighbors around me, hearing about their premiums coming out of their paychecks from the RIP, is just so incredibly sad. What this family could do with this money it would be so amazing to relieve our people of this, but there's a better way. Do I know what that is? I have no idea, but what we have in the systems that we have right now, it's just not fair, and it should be done and over with.
Yeah, and I want to bring up
Something needs
one
to
more
change.
thing with the time we have left. We were looking at a study at the beginning of this, finding that 7 in 10 adults say that denials for healthcare coverage or profits made by health insurance companies bear at least a moderate amount of responsibility for the CEO's death. What is your take? What is your response to that?
No, but I don't believe anyone should die. I don't believe anyone should have the repercussions of ending their lives. But people are angry. People have reasons to be very angry. And I feel that to my bones. I've seen it. I lived it. I processed them, and I denied them. It should stop.
Natalie Collins, I really appreciate your candor. I appreciate your time tonight. Thank you so much.
Thanks for watching. Go to joinnn.com to find NewsNation on your screen. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.